Okay. Welcome to the Revere Commission on Disabilities October 13th meeting at 6 p.m. We're going to rise for a salute of the flag. So I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, justice for all. Okay. I'm going to take it a little bit. Before I do a roll call of members, I have an announcement and actually something to read. So I'm just gonna pop it up on my screen here. So let's see. It's from Rick Frenny. Good afternoon, Ralph. It is with much regret that I must resign from the Commission on Disabilities effective immediately. With my pending shoulder and ankle operations and still suffering from lingering effects from last year's work related to an auto accident, I cannot give the COD the attention and devotion it truly deserves. It has been a pleasure and honor to serve with you and the board under the Arrigo administration. I know we did some good and still a lot of work needs to be done. I can and will continue to be a voice for the autism community. Regards, Rick Fernie Sr. So he, I guess he's been dealing with a lot of issues, and he had sent me this letter, an email around 2 o'clock today. So I was kind of put back to it and kind of it's sad to see Rick go. He was a great help and he was a great asset in the community, but I totally understand his situation. Wish him all the best, and will truly be missed on the Commission on Disabilities. So I just wanted to share that with them, and Rick, know they're always thinking about you, and I'm always there, and I always will be there. So good luck, and if anything you need, you know where we are. So I just wanted to pass that on, and wanted to start with that before I did a roll call of the members. So with that being said, I will do a roll call of the members. First one is Enza Goodwin.
Here.
Okay, Robert Bent. Could everybody hear that over the screen?
Yeah.
Yes.
Okay. He's on the phone with me because of some technical issues, so he can see the screen. He actually, I don't know if you wanted me to disclose anything, Robert, but Robert is presently back in for some medical issues. So he's joining us from the hospital right now, but we wish him the best. Next is Pauline Perno.
Present.
Albert Sheridan is absent, and myself, Ralph DeChico. As you see, we now have 2 open committee member positions on the Commission on Disabilities. So we're hoping that we can get some applications. As of again today, I checked. We still do not have any applications in. If anyone is willing to be a part of the Commission on Disabilities, they could go on to the City of Revere's website, and the boards and commissions, they'll be listed that we are presently looking for some members, and there's an application that could be there, and basically tells you what the qualifications would need to be a member of the Commission on Disabilities. And what it is basically you would just either yourself need to be disabled, or you have to have a family member that you're caretaker of that's disabled to become a member of the Commission on Disabilities. Once the application is in, those will get passed on through Human Resources to the Mayor's office. The Mayor's office would then submit your name to be appointed to the Commission on Disabilities through the appointment subcommittee for the City Council. And with the approval of the zoning subcommittee, they would ask for the full City Council's approval, and then you will become a member of the Commission on Disabilities. So we are looking for some great candidates to help us on the Commission on Disabilities. Item 1 on the commission, on our agenda is the motion to approve the meeting minutes from September 8th, 2020 meeting. Do I have a motion to approve?
Motion to approve.
Approved by Enza. Do I have a second?
Second.
And seconded by Pauline. Okay, so the meeting was approved. Okay, I'm taking notes at the same time, so I'm a little slow here. Okay, so item 2 is updates and next steps from the September meeting. We had one of the things that we had on the September meeting is that we were supposed to get some information back from Rick Frenny and Albert Sheridan. They were going to be starting to go around the city, drive by and see if they could collect any addresses that had any handicapped signs for us. With Albert not being here tonight, I do not have a status on that. And also with Rick resigning, I don't have that either. So I'm just going to table that until next month. I tried contacting Albert to see if he had that. So he did not get back to me. So we'll just hold that to next meeting.
Okay.
So I didn't know if anybody had any questions on that.
No.
No, but I'll take a look. I do a lot of walking up here through the pines, so I can kind of jot as I go just to kind of get a handle and see if there's anything out there.
Okay, I appreciate it.
Yep.
Robert, you're okay on the line there? Yep. Okay, I'm just going to keep this muted so I don't get feedback. If you just mute yours too, okay? Okay, item 3 was the Coda Commission on Disabilities monthly meeting. What we had was done on October 7th. There was just an announcement that the Disabilities having the 2020 Disability Summit is going to be on Thursday, October 29th from 9 a.m. to 1 p.m. It's hosted again by the Massachusetts Office on Disabilities. It's the 6th annual Disability Summit, but it's going to be virtually this year from 9 a.m. to 1 p.m. You can register online at www.mass.gov/MOD. The 2020 Disability Summit focuses on reasonable accommodations within employment and socialization in a virtual world with a wide range of engaging speakers from state government, nonprofit agencies, healthcare, and disability organizations. The goal in this year's 6th annual summit is to highlight accommodations, self-care, socializations, and resources during the pandemic that can be applied to our personal and professional lives. So they're trying to help with information for the pandemic. So that's what they're going to be trying to spearhead the whole Disability Summit on this year. A couple of the main meeting discussions that we had in the Coda. One of the big discussions was compensation on parking. A couple of the different area Commission on Disabilities had questions on how many parking spots should be handicapped, what the total number of spots is lowered. The state guideline is a certain ratio of spots should be handicapped. But there's a good argument that is a certain case the straight ratio would not capture the needs of spots being served. So what that basically means is a lot of buildings, a lot of cities and towns, when they're doing some new developments, they're asking for variances on the parking to lower the amount of parking. And what cities and towns are saying is, well, they should keep the handicap parking spots at the same, but because of the ADA rules, laws, and the AAV laws, it's not a certain amount of spots. It's a ratio. So it's a percentage of however many spots there are, a percentage of them have to be handicapped. So what I added to the input of that conversation is it's not something that the cities and towns can change. It has to be done on the state level. So instead of it being a ratio, because the cities and towns are not breaking any laws, they're following the AAB and the ADA laws by staying to the ratio. So what needs to be done is the disability advocates need to get on their state legislatures to see if they can have the laws and rules by the AAB and the ADA change that instead of it being a ratio, that it would have to be a specific amount of spots in order to keep that, you know, changed. But there's, as of right, as it is written right now, that's how it is. It's a ratio, it's a percentage. So it's not a certain amount of spots. It's not for every 20 spots, 2 spots have to be there. It's a ratio. It's a certain percentage. So if they ask for a decline from 1.5 spots per unit down to 1.25, just to say, this is just throwing numbers. So it will be an overall ratio percentage. So there's nothing that can be done to keep the same amount of parking spots for handicap, even though that they're going for a variance. So that was one of the discussions. The other main topic of discussion was a couple of the commission members were questioning why and how different commissions have their meetings televised. Not only now with, if they're Zoom, how they're hosting meetings, or any other ways that their Commission on Disabilities meetings are being done. There was a few Commission on Disability members from different cities and towns that took exception to meetings being televised and being recorded for various reasons. I stated that the city of Revere, not just through COVID, but whenever we were in the norm, what the norm used to be, our meetings were always covered by Revere TV. They were streamed on Revere TV's YouTube channel, and they were also recorded so that we could be rebroadcasted on the Revere TV or the YouTube channel. Number one, it's for open meetings, it's for transparency, and so for accountability. We have never had the situation, but I also said if someone comes, they made the case that if someone comes up to the Commission on Disabilities meeting with a sensitive matter, they may not want to talk. So you may be disenfranchising people from coming to the meeting. But I said we could always go into an executive session where the cameras are shut off. Anybody that is in the chamber would be asked to leave the chamber except for the resident who would like to speak on something and the commission members. So that's how I said that we would handle it. The city of Boston also agreed with me and said that that's how they would handle it. They haven't had to, but they do the same thing. Their meetings are also televised. They're also on their local channel, and they're recorded there for people that would want to see it after. So I don't know, some of these cities and towns want to take it to the Attorney General's office. I don't know what any of your feelings are on it, but like I said, to me, it's an open meeting. I don't know if somebody has an issue with it. We're all on this commission on behalf of the residents. We say at our meeting, if any resident has any questions, concerns, they can either come to the meeting or they can let us know what their questions and concerns. If they don't want to come in front of us, we can address it without them being present or without them being known. So to me, if I'm correct me if I'm wrong, I think we're handling it correctly. So I just wanted to bring that back and get, you know, your feelings on that. So I'm willing to hear that. Enza?
Yeah, Ralph, I couldn't agree with you more. Can you guys hear me or am I freezing up?
Yes.
Yep.
You,
No,
okay,
we
good,
can hear
thank you.
Yeah.
All right,
You're
thank you.
freezing, but we can hear you.
All right. No, I agree with you. And in addition to the reasons why we're recorded, I also think it's a good opportunity for people if they can't watch the meeting or be a part of it in the moment. On their own schedule, they can go back and listen and watch. So I think it's fair, and I agree with the rationale behind it, and I support it.
All right. Yeah, because that's the other thing is one of the people that are against the recording as well. You have a date and time when the meeting is, and that's when the people are supposed to come. I said, well, it doesn't always accommodate
Right.
people. So I really didn't agree with that rationale. And but I agreed to disagree with them.
Yeah, of course.
And that's, you know, everybody has their own opinion on it. but I just wanted to make sure, you know, how everybody else on our commission felt on it.
I stand with you 100%. And I think that everything is covered because we do have that. If there's something that wants to be addressed that you can't be there, you know, you'd like sensitivity handled a different way. But the other thing too is for a lot of people watching, not just this meeting, but the ones that are televised is really their only link. Everyone has been so shut in, especially during the COVID and isolated, that really watching these is really a way for them to stay connected to their city and to know that people are here for them. And I think that especially now that that really resonates more. And I think to take that away would just feel like, you know, everybody's just turning their back on the general public. And I support what we do 1,000%. So I'm 100% totally on board.
Robert, do you have anything you'd like to add to it? Robert, do you have anything you'd like to add?
I agree with both of them and Pauline. I mean, if these people can't watch us on TV, they don't know we exist. If they don't know we exist, we can't help them.
Right.
Thank you. Thank you. Okay, so I just wanted, those were the two main issues for this month's meeting. So I'll let you know if they follow up. I was very happy that the Boston Commission of Disabilities really agreed with me on that. So I felt good that I wasn't doing anything wrong, and that was good. Item number 4 is trying to get my computer. Is scheduled for October events. Enza, do you want me to read it for you, or do you have it? Or
I have it, and just if you can't hear me at any point, just feel free to interrupt.
Okay.
I am excited and happy to announce that CPAC will be holding 2 events this month. One will be taking place tomorrow night. The Boston Center for Independent Living is offering a workshop for teens and young adults ages 14 to 22. I had made a mistake, Ralph, when I shared the information with you, so I want to clarify. Tomorrow night's event will be offering virtual youth opportunities for teens and young adults ages 14 to 22. The presenter, Mary Kate Wells, is a pre-employment coordinator with Boston Center for Independent Living. So hopefully tomorrow night she's going to offer our teens and young adults some opportunities that are available. And I would imagine if anyone has any questions regarding employment opportunities or training, she will address that as well. So I just wanted to clarify that. And then next Thursday on the 22nd, CPAC will offer an open forum, and we are excited to have Dr. Gallucci in attendance. And he's going to listen to and answer any questions from families. And more information on both offerings can be found on CPAC's Facebook and Twitter sites. And I would love to see a big turnout at both events, but I'm really encouraging any families who are listening and watching to come to the open forum next week. It's important that families share and ask questions, especially during remote learning. We just have to kind of band together and support one another.
it's
And sorry, Ralph.
tomorrow night.
What
I'm sorry,
time?
Ralph. So tomorrow night will be taking place at 6 p.m. and registration for both is required. So if you go to the Facebook or Twitter sites, there's a flyer with information on how to register. And the event on the 22nd is at 4 p.m.
Okay.
So,
And is it just CPAC? Do you have the Facebook or?
so I don't have that. I believe it's CPAC Revere or Revere CPAC. If you put in either one, it'll come right up.
Okay. All right. Thank you. Perfect. So yeah, if you so tomorrow night, so instead of it's just changed from regarding employment training, it's just changed the title of it.
Exactly. Yes. Same presenter, same organization, same time, just a different title.
can you shoot me an email with that so that I can update that in the notes?
Absolutely, yes.
Thank you. Thank you.
Yeah.
Okay. So any questions on that, anyone? Pauline, any other questions just besides the
No,
top?
I think this is an excellent opportunity, especially during this learning or virtual learning that we're all doing, to keep everybody, families, and especially the teens and the young adults that it's a struggling time anyway in their life, but struggling during COVID and isolation. I think that this is really an excellent, excellent opportunity for families. So I too hope you have an excellent turnout, Enza.
Thank you, Pauline. I agree.
Yes, definitely. All right. Item number 5 is late items. I didn't know if any of the members have any late items before I bring up a couple of them. The Enza or Pauline or Robert?
No.
No, nothing.
Okay. One of the things that I have that I've been working on is I've been looking for, they're called smile masks. They're clear masks. I've been looking on trying to procure getting smile masks for adults and children that are hearing impaired. I have the city of Revere, the mayor's office has agreed to purchase them for the Commission on Disabilities through the city. Just in the process of trying to procure some pricing and some different masks. So I've reached out to a local company in the Boston area. So they're sending me some information and they're going to be sending me some samples. So hopefully by next month, I will be able to have some more information. But the main hurdle was trying to find a company, and the best part is the city is going to be able to fund that for us. Because there are children and adults that are hearing impaired, and they depend on lip reading. So I think that's something that is needed. It's something that's been on my back burner. I've just been doing a bunch of different things, and I've been trying to get that done, and I'm almost at the finish line to get that done. So that's that. Another thing that I'm working on with Enza is we're trying to find some special one-on-one tutoring that we're trying to get some funds allocated for some of the students that special ed and with some disabilities. So we're working on that, and hopefully there'll be more to come. So I have brought an Enza in on that with me, along with Jacqueline Roy. So once I have some more information on that, I'll be passing that along.
Excellent.
So Pauline, I may need to look to you to give us some help on that.
Absolutely.
I have a bunch of information that we need to check in on.
Okay.
So I'll try and touch base with you on that. There's just so many things in the air right now, and I don't know which way to go. And then I get another thing pushed on today. So I'm just trying to keep it all in perspective. So that's
You're
what
doing it.
Yeah, that's what I have for late items. I also wanted to update everyone that we received a thank you card from Carol Ty, Commission on Disabilities, for getting the 4 handicap spots put in finally at the stadium. It was 4 handicap spots that got put in over there. So she sent me a card in the mail thanking us for that. So I just wanted to acknowledge to her that I did receive the card, and no thanks was needed. It was something that should have been done a long time ago, and I was glad to help get that facilitated. I know we have a resident on here. I'm not sure if it says Alicia's iPad, because right now is residents' concerns, issues, questions are open forum. So I'm not sure if she has any questions. I pushed it allow to talk. So if they have any questions or concerns. they can unmute themselves. Okay. So I don't think they have any questions or concerns. Any other commission member have anything else that they want to bring up, or any other concerns or any other ideas you want to look into, want me to look into, something you want me to try and find? That we also were notified by the city of Boston that they had some over purchased handicap sidewalk ramps that they purchased for sidewalk restaurants. So I had passed that information on to community development office. I know, I think Julie DeMoro was working on that. Speaking of that, they are, Julie also was applying for an MOD grant that I had given her information. Thank her for spearheading that for me to try and facilitate, because of the new signalization that's going in on Broadway. There wasn't enough money to do some of the infrastructure work that we want done for ADA. So she's going after some grants for that, for some extra ramping and some extra automated signalization. So she's going after that grant. The grant had to be put in last Friday. So she worked diligently on that for me to get all that paperwork in. So there's a lot happening, a lot of help. I can't thank everybody enough for helping me out and all this during this time. I know I'm probably forgetting some things. I have papers written everywhere. I don't even know where everything is anymore. But I'm trying to keep it together. I am facilitating a lot of phone calls still from the Commission on Disabilities. There's no update on an office yet right now. Everybody can still keep calling the Commission on Disabilities number, and they will be getting a call back from me, usually either the same day or the next day, with any questions or concerns. That's what I have on that. Any other members have anything else they'd like to talk about?
No, that's a lot of information. So, if you need any help, certainly reach out. I'm here.
Okay. So what I'm going to do is item 7. I will read this because in case Enza goes out, even though we like hearing Enza read this. So item 7 is the reminder: the Commission on Disabilities, due to COVID-19 and the safety of all residents, is trying to limit in-person appointments due to the unavailability and use of our present office locations. Residents can speak to staff from our 301 Constituent Service Center Monday through Friday when you call our office at 781-286-8267. They will be able to answer most questions, but if they are unable to, or if you would like a call back from our office, please ask to be transferred to Disabilities Office's voicemail, and someone will get back to you as soon as possible. We are working on solidifying another temporary location for our office with necessary in-person appointments determined by the COD on Friday mornings. We will update this information when available on disability page and on the city website. As always, please let us know if you would like something discussed or brought up and added to our monthly meeting agenda. You can let us know if you would like to speak on any issue or concern. The Commission is here to help and assist all of the disabled residents and families of Revere. So our next steps is we're just going to wait see if Alfred has any updates or any handicap parking spaces, and see if I get any emails that could be left over from Rick and Pauline. If you get any, we're just going to jot down any addresses that have handicap signs. I want to try and get them mapped out through the whole city, and then I want to talk to the city and see if I can get them all put into the GIS system so we know what they are. Any ones that are not on the city ordinance, then we can go to the Traffic Commission on that, and they can handle it from there. So that's one of the aspects there. Next steps is next meeting. I'll also try and have more information, hopefully update you on the smile masks, and then the other initiative that I'm working on with Enza. Am I missing anything?
No, I think you got it all.
Yeah,
Enza, hopefully you'll be able to update us on how the meeting went.
absolutely. Yeah. And we're already planning a couple events for November, so we know that we have some more stuff coming along.
Okay.
Yeah.
All right. And with that, I'll ask for a motion to adjourn.
Motion to adjourn.
Okay, and do I have a second?
I'll second it.
And Pauline seconded. Next meeting will be Tuesday, November 10th, 2020 at 6 p.m. One last thing I want to mention, that the city census, if you have not filled it out, please do. It has been extended. So please fill out Census 2020. If you have not, it only benefits the city of Revere. It benefits the residents and helps us to provide services and helps us to provide infrastructure that we need to get done. So it benefits all the residents of Revere. With that, that's all that I have. So I thank my members for joining in, and thank you to the residents of Revere. And remember, we're here if you need anything. Thank you,
Thank
and
you.
have a good night. Stay
You
safe.
too.
Bye, everyone.
Stay safe.